Recovery in elite sports received lots of attention over the years, especially with the demands of competition and in particular team sports increasing. However, within the elite domain there are constraints such as travel and fixture congestion that may actually disrupt the recovery process. In this paper, Dr. Robin Thorpe presents a practical framework to enhance recovery in athletes. One of the key points of the paper is the understanding of the origins of fatigue before the prescription of the recovery strategy, or indeed strategies. Ultimately, the recovery strategy or modality selected is done so with the aim of restoring homeostasis, both physiologically and psychologically. Currently though, much of the positive evidence for recovery strategies may be attributed to the athlete's perception of recovery, the belief in the modality, or the placebo effect. Fatigue, in a broad sense, is complex and it's often but incorrectly thought of as a single entity, which it's not. Therefore, a one-size-fits-all approach may not be in the best interest of the athletes. In fact, the complexity of fatigue, a single intervention used chronically, may actually negate the adaptation process. Conversely, there are also reasons why athletes may be exposed to multiple recovery modalities, such as professional philosophy and strategies that are proposed to enhance recovery, but may lack solid physiology-based rationale. And this could be problematic, as it then becomes a throw the kitchen sink at it and just hope for the best approach. Still, a multiple strategy approach is a step in the right direction. What is presented in this paper is a symptom-based framework for the periodization of recovery. Fundamentally, the framework is built on the understanding of the symptoms derived from mechanical stress, such as excessive eccentric muscle contractions, and metabolic disruption, such as reductions in ATP, creatine phosphate, muscle glycogen, and biochemical changes in electrolytes and calcium, all which may contribute to fatigue in athletes. Therefore, Dr. Thorpe's framework allows for the prioritization of recovery strategies which match the associated physiological stress on the athlete along the recovery continuum. The framework presents both cooling and heating modalities to either decrease or increase muscle temperature respectively. Essentially, the framework presented allows for the manipulation of blood flow by either restricting by cooling or increasing by heating muscle temperature. Reducing muscle tissue temperature in cooling has been shown to mediate the secondary change from mechanical stress, while heat has been demonstrated to alleviate the metabolic associated fatigue. However, as pointed out in this paper by Dr. Thorpe, while this paper provides a symptom-based framework for recovery, the fundamentals of sleep, rest, hydration, nutrition and joint range of motion still remain. If there is an absence of sufficient athlete fatigue monitoring, then Dr. Thorpe recommends the use of generic cooling first and heat second to avoid any detrimental effects on the athlete.